It becomes a mental health condition when it's affecting one's ability to function in the world we live in. So function in terms of functioning at work, at home, with oneself. That's when it's now a problem. When one is unable to do stuff you do on a normal day as a result of the impact the traumatic event has had on them. It's very important for everybody to have it. If you've, for some reason, let your guards down and you've been exploited, lick your wounds, learn from it. Otherwise, you're not a wise human then if you keep making the same mistakes. But as much as you're setting those boundaries, don't lose your core values. Don't let people's exploitative approaches towards you stop you from either being a caring person or doing right.
Welcome back to another episode of Rhoda 360. This space we look at life, growth, and wellness from all angles. That's a 360 degrees meaning of Rhoda 360. Today we are stepping into a profound and important conversation, and because we often think of childhood as a time that passes when one reaches 16 or 18 or even 21. But the truth is, whatever happens to us in our earliest days often writes the scripts for how we show up as adults, especially in our careers, our finances, our mental health, our relationships. Joining me today to unpack all this from a psychiatric perspective is the incredible Dr. Kemi. Born and trained in Nigeria, Dr. Kemi is now practicing in the UK, and she brings a wealth of knowledge, both clinical and cultural. And these insights are very important to this topic, especially as Africans. So welcome to Rhoda 360.
Thank you so much for having me. I was born in Nigeria and I trained in Nigeria as well with Canadian University of Okada. Initially practiced as a pediatrician in Abuja for a while before relocating to England in 2017. And then I embarked on training in psychiatry. And that took me about 6 years. At the moment, I'm a general adult psychiatrist working in the community mental health team. And where the focus of my job is seeing patients between the ages of 80 to 65 who have severe and enduring mental health condition, which may or may not be related to trauma.
Yeah. So my initial question for you would be why mental health, why psychiatry, why this
Thank you very much for that question. I think over the years we've zoomed into physical health to a great deal, and I'm of the opinion that mental health has been neglected a lot. I think it's not a very glamorous profession, to be fair, more so in the third world country because of the stigma that's associated with having a mental health condition. And I think I realized there's a gap, and I thought I was prepared to step in to contribute my quota. Hence the reason why I took up that role.
Thank you so much for sharing that. To set the stage for our listeners or people watching this episode from YouTube, when we talk about childhood trauma or childhood abuse from a clinical standpoint, what does that mean? What does it encompass?
And so it means different things to different people, and it's established that. So no two persons who have experienced trauma will present the same way. A couple of factors contribute to how people may present, those who may have experienced trauma. But in the most simplistic term, I want us to think about trauma as any life experience that threatens our safety, our sense of survival. And as a result, the body goes into a flight or a fight mode. It's either you survive or you die kind of state. So whatever it is that threatens our existence, any life experience that threatens one's existence, they may not be an actual threat. The mere perception of the threat is sufficient. Hence the reason why I said no two persons experience trauma alike.
So it doesn't have to be physical, right? It doesn't have to
Absolutely.
just be physical.
So there are different kinds of trauma, and there are different kinds of traumatic events. So it ranges from emotional abuse, neglect, physical abuse as well. Yeah. So there are a couple of things that qualifies as trauma. There's in fact and the concept of intergenerational trauma as well. Things that have been passed on from one's parents to offsprings, and it carries on in the family. There's also something called moral injury, where you realize some things that happened are in complete out of tandem with your values and your morals. In that moment, you're in a state of conflict, trying to match up what you stand for and the situation you've been put in to function. So that in itself can be traumatic. So there are different kinds of trauma.
Yeah. But do you think, um, I mean, from patients you've seen or people you've spoken to, do you think children recognize this, or it's when people become adults that they recognize that okay, whatever they had been through was traumatic or was an adverse
Yeah. So I would say the
experience?
body keeps the score. So it's almost like there's scars for any traumatic event. So as a child, the baby may not be cognitively developed, or they may not have developed sufficient language to articulate what the experience is. But that does not make it any less traumatic. And unfortunately, down the line, it may manifest in different ways, you see. So yes, children may not be able to articulate what's happened, but that does not mean the body doesn't keep the score. So there's an imprint of traumatic events in children's memories, and then it can pan out down the line in their lives as adults.
Yeah, yeah, that was going to take me to the second question, asking how the child's developing brain and nervous system behaves during chronic
Okay.
stress or
So
abuse.
I'll just put a bit of a medical term out there, but I'll try to explain as much as possible. So
Yeah.
the way we are as humans, we have something called the hypothalamus pituitary axis. So it's just the hypothalamus and the pituitary structure in the brain. And what this structure does is to produce hormones that helps us to function basically. There's an extension of it also at the adrenal. So the adrenal gland is just on top of the kidneys as well. And all of these things produce what we call cortisol and produce adrenaline as well. All of them are stress hormones. They are helpful if there's actual threat, and as long as it's just for a short period.
Yeah.
It becomes a problem if it's never extinguished. So back to your question about what happens to a growing brain. So the concept of constantly being under threat means the body carries on producing this hormone and does not know when to extinguish the production of it. Unfortunately, it has adverse effects on all of the organs, the systems in the body, ranging from the cardiovascular system, the heart, the blood vessels, the immunity as well. So yes, it affects everyone, including children, even before a baby is born, whilst in the mother's womb. Yeah.
Oh, wow. Okay. Now you've trained in Nigeria, and now at least you practice there. Now
Yeah.
practicing in the UK too. Have you noticed any difference or universal
In-
similarities in how adults from different cultural backgrounds
yeah.
present their trauma?
Thanks for that question. So yes, I've trained in both side of the world, so to say. But there's something I want to establish. No two persons present alike, even within same culture. How much more in two different cultures? In Nigeria, sometimes I think we crack on. We're born to be resilient, so to say, or maybe we pay lesser attention to the emotional impact certain things will have, or maybe the community you're born into. And sometimes you're not just raised by your parents. I think we're very communal as a society. So one way or the other, you see people ahead of you cracking on with life, so you learn by observation to carry on. So maybe that means we don't speak about it as much. Maybe we don't brew on it. We just crack on basically, and we're also anyway. That's as far as I'm concerned. So people may have a different take on it, but I think we're a religious community also. So the sense of knowing that there's something bigger than you helps you to cope with traumatic events, even if you don't have the actual answers. So we have our pastors and imams, for example, or stepping into the role of an emotional cushion. Yeah, you could sometimes discuss certain things with them. You pray and you know that there's a supernatural being there that can help you figure things out, even if you don't have it all figured out. My experience so far in England has been there's room to talk about emotions. Children are taught to talk about how they are feeling. I think people talk about it more, and as a result, maybe people get help quicker, or maybe there's that availability bias. If you're talking about it, then everybody's sensitized to know what's going on. And I think that has been my experience and how things differ across board. Yeah.
Do you think this is the reason why some Nigerian or even African professionals hide themselves, or for lack of better word, like keep to themselves when they go abroad, because the culture shock of talking out, of speaking out when people feel anything, it's kind of so heavy on them. We are not used to talking. For instance, when I came here, when I started my program here, I noticed students could call the lecturers and our supervisors by name. I I have never had to call even someone like a year my senior, or even sometimes my age mate by name. Till now I still battle it. But then one day she told me, Ruda, it's okay, call me by name. Till now I can't look into her eye and call her by name. Do you think it's all part of whatever some of us have been through as
I
children?
disagree though. Culture differ, but none is superior to the other. I'm Yoruba from my name. We're a very respectful bunch. Maybe we exaggerate it sometimes, but for structures to be maintained within a society and for orderliness, there's a need for respect. The way we show it now differs. If you decide to call people by massa or be outrightly overt about how you convey respect, and then another culture may be more covert about it, but that does not mean they don't respect. And I think that's where the culture shock comes for someone who may have come from a high powered culture. That means we show respect overtly because we're now confused. We're used to the massa. So there's no uncertainty about whether or not my behaviors can be misunderstood. You know I'm actually being respectful here. But you're coming to a place where it's in the tiny bit, it's in nuances, it's in the gray area. So you need to learn how do they convey respect here without having to be overt like where you're coming from. But back to what you said, I think no culture is superior. I was raised to say massa. I think it's for orderliness sake. I think part of the human flexibility and ability to survive is to be able to fit in when you come here. You realize, okay, maybe they don't do it this way. You decide to tone things down. But don't forget the home culture. You go back home, you still go back to say your man, sir. Otherwise, they'll put you back where you belong because that will not be acceptable in that space. So I don't think that translates into experience of trauma. I completely disagree. Um, the question would be what would be the motive between interactions? If you're saying auntie, uncle, mister, or calling people with titles attached to their names, is it born out of genuine respect? They also respect you, or is it just their eye service? If the relationship is healthy,
Yeah,
irrespective
makes
of
sense. Yeah.
what prefix you decided to put in front of their name, I think is immaterial. I also still struggle to call people by their first names because I wasn't just raised that way, but I had to learn. Yeah.
Yeah. So let's talk about how unresolved childhood trauma manifests differently in adults,
Hmm.
men versus women.
Okay. So, I think for women, maybe you're more likely to pick on things. For men,
Yeah.
it may manifest as maybe it depends on. So back before I answer your question, I'll talk about when was a traumatic event experienced. That determines how someone will manifest. So someone who may have experienced childhood trauma when the brain is still in its formative stage, oftentimes the impact of the traumatic event manifests in their relationships and interactions with others, and also interaction and relationship with self. The ability to contain one's emotion or control how one is feeling may be more dysregulated as a child who may have experienced a traumatic experience whilst growing up.
Sorry, when is the brain in its
So
formative state
about
again?
80% of brain development happens in the first 2 years of life. Yeah. But yeah, 80%. So no major traumatic, no physical injury should have happened to the brain. Otherwise, it will manifest as cerebral palsy and other things. But remaining 20% then happens as someone progresses, even up to mid 20s. That's when the frontal lobe is fully developed. But the bulk of brain development happens in the first 2 years of life. So if someone has experienced a traumatic event or series of traumatic events whilst growing up, it translates into their understanding of how relationships should be growing up.
Yeah.
And sorry, as an adult, I mean relationship to self, relationship with significant others as well. But if it was just a one-off traumatic experience, say for example, a car crash or a flight
Yeah.
that crashed, the presentation is different. The manifestation may come across as symptoms of post-traumatic stress disorder. So they may have hypervigilance, increased lateral response, they easily get fidgety, they may have nightmares, they may be more irritable. But you'll be able to attach the changes to the event, the circumscribed traumatic event. On the other hand, trauma in the growing up in growing up years manifests in relationships more and ability to contain one or control one's emotions.
Okay, before we go on, I just quickly wanted to ask, um, between birth and 2 years old, if whatever happens to, if the child goes through some form of physical abuse or even some form of neglect, do you think the body will remember when that child becomes an adult or when that child begins to develop into adulthood?
So there are a couple of factors that come into play here. Is it a continuous, consistent neglect all through their lives, or was there a period where some savior stepped in to save the child from that environment? Also, there's still genetic aspect to things, ability to build resilience. Some people equally go through traumatic events, but they turn out well off. So sort of they call it post-traumatic. Um, there's a name for it now. Post-traumatic growth. It's called. In fact, you learn off the traumatic experience. So a couple of factors come into play. One's genetic build-up. Was there somebody else who swapped the child off from that unhealthy environment? Who was the context? What was the severity and for how long did they have to endure the traumatic event for? All of that will account for how severe the impact of the trauma may be down the line.
Okay. Can you like give us an example of how maybe a man might mask trauma
So
compared to a woman? Because we know that
we'll talk
women
about it.
we speak.
Yeah, we do.
We talk
Yeah,
easily.
we do. Maybe the talking helps to decompress a bit. But men may resort to maybe violence, sometimes antisocial behaviors, sometimes drugs and alcohol to numb everything. Yeah, you drink, suppress how you're feeling, basically. So yeah, that may be how a man will present. Sometimes it may also result in mental health condition, and that's where the psychiatrist steps in. Oh, yeah.
Yes. Yeah, and quickly, that's what I really wanted you to maybe speak about. How this thing we call trauma, this thing lay people like us call trauma, how it evolves into a psychiatric problem. Because I feel most people that went through, traumatic experiences. I mean, we would not have time on this episode for me to really like to share one or two of my own instances, but I have done that in previous episodes. I feel most of us will need some form of psychiatric evaluation. We'll get to that. However, how is this? Can you like clearly just highlight the connection, the relationship between, okay, this is trauma, and this is the point where it becomes a
Yeah.
psychiatric
Yeah, thank
condition.
you. I know we use that word a lot. Many people say, "Oh, I've been traumatized by that," just yeah, throw it around. But it becomes a mental health condition when it's affecting one's ability to function in the world we live in. So, function in terms of functioning at work, at home, with oneself. That's when it's now a problem. When one is unable to do stuff you do on a normal day as a result of the impact a traumatic event has had on them. In psychiatry, the way things are and when we're trying to understand the etiology or the cause for someone's difficulties, we usually use a framework of formulation to talk about what predisposed somebody to becoming psychiatrically unwell, what were the precipitating factors, what perpetuating factors and all. So it's a mix of many things, almost as if you're preparing a pot of soup and what were those things that made it turn out this way, basically. So for it to qualify as a psychiatric condition, functioning has been impaired. For someone to end up with a psychiatric condition, maybe there were some predisposition before. So say, for example, the 2-year-old analogy we made earlier, who has experienced trauma at an earlier age, they may or may not turn out resilient. The chances are maybe they're not as resilient as their peer who grew up in a more nurturing environment. If life becomes more difficult, the one who was raised in a nurturing home is more likely to have the internal strength to cope with challenges than someone who already has gone through so much. Like we said, immunity is equally affected. They're constantly under threat. There's that stress response constantly in the background. So it also hinders their ability to cope, basically.
Wow. Thank you so much for sharing that. Trauma doesn't look the same at all ages. For instance, at 25 versus at 55. How does this show up in younger adults, like in their career choices, early relationships versus middle-aged
Yes,
or older
thank you.
adults?
So sometimes I won't say we're unlikely. I will take that back. I think our
Yeah.
suspicion of trauma in older people is less. We think you've gone through your active years. Why haven't you picked it sooner? We're more likely maybe to pick it in younger years, maybe people who are in their 20s, for example. I suppose maybe that has to do with that's the stage in one's life when you desire to be in some form of relationship. You're at your peak, so to say, in terms of deciding on life partner and also deciding on career choices. I'll imagine the choice has started from late teenage years, obviously. And then it comes to the fore because you realize these people now begin to struggle to function at work. Maybe getting laid off, not, not being able to keep a job down, maybe fighting at work, for example. Or, yeah. And then some other times, even in relationships, they may struggle to sustain and keep long-term relationships. That's usually what may be the clarion call for us to unpick what exactly is going on here. They may also turn some of the distress inwards or even outward by way of self-habit. So maybe acting impulsively, not thinking things through, just acting based on how you're feeling I feel angry and then I become quite destructive as a result of it, for example. Or maybe, yeah, drugs, alcohol comes into the picture for different reasons, you see. Sometimes to numb how they're feeling, they just don't want to feel the way they are feeling. So I've heard my patients say things along the lines of, I'd rather feel physical pain than emotional pain, because at least you can point at what is painful. Yeah, emotional, it is quite abstract sometimes. You struggle to articulate how exactly you're feeling. So yeah, they've used those kind of terminologies. So back to what you said, in people's twenties, their mid twenties, thereabout, you're more likely to see people or come across with failed relationship basically itself and with the world around them. In people who are in their fifties, I think you still see a bit of that though. They are more likely to tell you about how things may have been missed earlier on in their lives. So maybe they've struggled, things were not picked up for many years, so they've lived a dysfunctional life for most part. Maybe there was another superimposed mental health condition that may have brought them to hospital. So maybe depression, for example, or maybe they've ended up with a psychotic illness. And in that moment, you're working your way backwards. You now realize, hold on, there was a defective framework, which is the personality that has never been picked up. So by then, you may be diagnosed with a co-occurring mental health condition on the background of a flawed, I won't use that word for a disordered person. I think that's a very difficult word to use. I'm always very careful using that word disordered because that's you describing someone who, for no fault of theirs, turned out maybe less able to cope with the world they're living in. Yeah. But
But before these patients come in, or before you see these people, are they really able to recognize that whatever they are battling was a result of adverse childhood experiences, or they just come in and present as,
I
with this
think it's also a
condition?
function of how enlightened or exposed the person is in this era of social media. Chances are things are all over the place. There's Dr. Google as well. Before people come to see their doctors, they've Googled some of them.
There's now
So
AI.
they may have, some of them may have some ideas. You may not be fully formed, but they have ideas of why they are presenting the way they are presenting. So yeah, and then when they come, they just want an explanation, and beyond explanation, maybe an intervention also. So yes, I found myself here. How do I, an okay, like
Yeah. Are they like in trying to heal, or in deciding to start the healing process, do they allow themselves to confront people or situations that have traumatized them?
So it depends on what kind of trauma it is. It is a second. So sometimes there are different classification of trauma, but you may hear things along the lines of and type 1 or type 2 trauma. So type 1 is maybe someone who may have experienced maybe a circumscribed traumatic event, something happened, a crash, something catastrophic happened, just one on 9/11, for example. Someone else who may have had recurring trauma through their developmental years. Those are called complex traumas if they've had multiple. The treatment modality is different. Someone who has had a circumscribed traumatic event is more likely to benefit from the likes of EMDR. So EMDR is an eye movement desensitization kind of treatment where there's a way the eye movement programs the way traumatic memories are stored in the brain. That's one of the treatment modality. There's also the CBT approach for those who have gone through trauma. So there are a couple of psychological intervention in that regard. For someone who has gone through complex series of traumas during their developmental phase, they've never learned a healthy way to attach, to relate with other people around them. So you're trying to teach them a more adaptive way. Those kind of treatments will come in the form of dialectical behavioral therapy, and is a very prolonged treatment in group setting. Yeah, you're trying to help them to become more mindful, to manage um, interpersonal relationship more effectively. Yeah, also to build resilience and all. So yeah, it's a different treatment modality. It's someone who has gone through complex trauma.
Wow. Okay. So what about older adults now, say 65 and above, who maybe because of maybe cultural values or moral values and are just, trying to confront past wounds. How does it present like in them, and how do you see them talk
I
about
think
it?
I don't see so much of those who are 65 and over. So the patients I look after is between the ages of 18 and 65. But if I'm to talk about those who are at that 65-year-old mark, who I may be transferring over to an old age psychiatrist, the chances are some of their presentation may be similar to those who are within their working years in terms of how they want to confront it. It depends on what is the most problematic of their presentation. So, what do you really want to work on? What do you think affects you the most on a day to day basis? Yeah, that may be the first step to addressing things. Sometimes you also need to also consider their significant other. It may be a family approach also. Yeah, you may want the family to also understand what the difficulties are because that improves their chances of improvement compared to trying to be that system alone.
Mm. Okay, so entering a new phase of life like relocation, like marriage or long-term kind of romantic partnerships, things like that, or even retirement for some people becoming grandparents. Do these things like trigger old memories of child abuse if there was child abuse
Yes,
in
it
one's
can
life?
do. Yeah, it can. If
Okay.
if there's another major life event, it can trigger unhealed wounds, for example. Retirement is a huge time in the life of most people. I'm not retired yet, but from speaking to those who may have, the children have left the nest. So there's that loss of role. You're used to catering for children, or you need to pack their lunch boxes, you need to drive them to school. That huge chunk of daily activity is lost, so to say. So you may have time to reflect more, think about things that may have been done differently. Also think about things that may have happened previously, unhealed wounds may come to the surface in that moment. In terms of partnership, long-term partnership, people who have suffered sexual abuse, for example, yes, that will come to the fore. They may struggle with intimacy. Yeah.
Mm. Okay. Yeah, it really took me back to to when I started having kids. Till now, in fact, in my own case, I think I'd always knew there was a problem with the way I grew up and situations around the decisions I took when sometimes in my teenage years and early adult life. But then I didn't know, I didn't have a name for it because I didn't know how to. I mean, who was I to even say, okay, I was hurt as a child? I didn't
Oh,
know if I was hurt or not until I started going out and I started seeing how other people behave. I started seeing how um, children or people like me related with their parents. I started seeing that, oh, people could actually say, Daddy, this hurts me. And then the dad would be like, oh, really? Sorry. I'm like, oh, really? This happens, this existed. So when I started having kids and as my children are growing up now, there comes this point where I get angry. Not with them, not at my kids, but like, why didn't I have this life? Why? What happened? So I keep asking myself that question. I know, like I keep saying, healing is a lifelong thing for some people. Some people are lucky to, just embark on the healing process and just do it, and it works for them. But for people like us, we're going to heal along the line, especially um if our own injury was done, like you said, along, it was a continuous process. It wasn't like a one time thing of accident or crash or something. No, it was in fact, if I allow it now, it will happen to me right now. Yeah, so yeah, thanks for sharing this is just some reflective
Yeah, thank you.
moment for me.
No
Yeah,
worries
thanks
at
for
all.
sharing all that. So let's go to the ripple effects this have on people's daily lives, because a lot of people watching this podcast, in fact this podcast was built on, that foundation, on how trauma from the past affects people's decisions, especially career wise. Yeah, career wise. So a lot of us are navigating the chaos of careers and families. Now, how does someone's unhealed childhood trauma or childhood abuse affect their ability to set healthy professional or
Yeah,
personal boundaries?
thank you for that. So, about the question you asked about how trauma may inform our choices when it comes to career. I don't know if you heard the word, oh, trauma bonding. Or sometimes people end up with people who they may share certain, I don't know. Well, anyway, back to what I was about to say. Some It's not unusual for people out of genuine need to make a difference, to go all out, to pick a profession that relates to some of traumatic experiences they may have had, maybe because they want to make a difference in the world they're living in. That could be the reason why they've decided to pick those careers. Or maybe it's not even directly related to them. Maybe somebody else close to them, for example, and they just feel they want to make a difference. That may be the real reason why they decided to pick up a career path. So that's it with career. And some other people, I don't know, everybody may have different explanation as to why they decided to pick up a career choice, but it's not unusual for people who go into some profession to be inspired by some of life experiences, either their own experience or some people around them. But the second question you asked wasn't related to career, personal boundaries are what.
Personal boundaries.
So the concept of personal boundaries, I think some people are better than others. Maybe maybe this is me now talking based off what I think or some of my own personal experience. Some people may be more of an empath, expect other people to be reasonable, maybe make sensible expectations of others. But unfortunately, humans are sometimes not like that, or people are exploiters. But I keep reminding myself,
Yeah.
don't let some people's maybe life choices inform how you decide to live your life. Otherwise, you're no more in control. When it comes to boundaries, it's also very important for everybody to have it. If you've, for some reason, let your guards down and you've been exploited, lick your wounds, learn from it. Otherwise, you're not a wise human then if you keep making the same mistakes. But as much as you're setting those boundaries, don't lose your core values. Don't let people's exploitative approaches towards you stop you from either being a caring person or doing right by people, because I don't think everybody is going to be either exploitative or take advantage of you. That may be a rigmarole way to explain it. But I think the concept of boundaries, I've not seen anyone who has it all figured out. I'm so boundary in every aspect of my life. Sometimes you still let your guards down. Maybe because you still believe humans should be good people. And some other time maybe you're just completely naive or yeah, naive would be the word. So professional boundaries, workplace is for business, nothing else than business. Sometimes be compassionate towards your peers at work. You get to know people for who they are as time progresses. you will now, whatever you learn, you use it to define how boundary you should be with each person. That would be what I will advise. That's not off the books. It's just based on what I think.
Yeah. Dr. Kemi, let me take you back a bit
Yeah.
to family. Now, for people that have gone through adverse childhood experiences from family,
Okay.
their own background, how do we set boundaries without it looking as though we're ungrateful, without it looking as though we, because we have achieved a certain level, of life now, we are now just trying to leave them. How do we actually let them know that, look, I'm hurt. Being with you will keep hurting our relationship. How do we set that boundaries with family that have?
I think it's not different from setting boundaries with anyone, to be fair. It's still a function of in what area you try and set boundaries in. Do you feel exploited? Prioritize yourself. And the concept of being exploited would be something happened. You went and you had a period of introspection. You realized this was not acceptable. You learned of it and you put strategies in place for it not to happen again. That's applicable to every human that you may have business with and dealings with. With family, it gets complicated sometimes because, yeah, there's that emotional ties, You may feel you owe them, or it depends on what you feel they're trying to exploit you of. If it's finances, because I know that most times if you're abroad, maybe there's that expectation of, oh, maybe you're living off, which sometimes an assumption, maybe it's genuinely not true. And you have to be consistent. Let your no be no, and let it be constantly no. They'll finally learn. Those who are meant for you will stick in there. Those who don't respect your boundaries are not meant for you in the first place. Yeah.
Wow. Then there's this guilt that is associated with setting boundaries with families. Is this some form of, how do we deal with that emotional guilt? Family, like you said, is a really complicated situation when you're setting boundaries. It might not be financial. It might just be that these people are used to seeing you as someone that absorbs their toxic behaviors. And when you stop playing that role for them, you become an enemy. And because you're trying to avoid, that situation with them, they may be the only family you've ever known, or they may be the only family you have at the moment. How do you now, you know, let them go or let them off without actually
I
feeling
think you
that?
need to ask yourself some questions and answer those questions. Why do you have the need for their approval? Why? Maybe you need a personal walk with yourself. So the concept of trauma again, and when we talk about how it manifests in relationships with self and relationships with those around us. Maybe the first step is to address the relationship with self. Accept yourself, your flaws, your strengths. Some degree of self-awareness is required. When you finish doing that, and hopefully it may be a lifelong journey, or one could be successful enough to do it and do it well. But however one decides to do it, be compassionate with yourself along the way. Learning does not happen instantly, especially if you've been molded in a certain way. But the first question is, why do I need to keep hanging on to someone who is exploitative or who doesn't respect me? Why? If we're able to answer that question, I think that guides us. And the why differs to different people again. If it were in a psychiatric clinic, it's still back to the formulation. We'll try to understand the why.
Yeah. Wow,
Well,
thank you so much. Now, for those who are parents, there's we have this deep fear of repeating cycles. How does this trauma subconsciously influence how we parent our children? Do we end up spoiling them or?
So it could go both ends. It's either we replicate what we experience
Yeah.
because we don't know any better, or we may overcompensate. It may be that.
Yeah.
There's no manual for parenting any person. As far as I'm concerned, there's so many self-help books.
Yeah.
Yeah, that's what I do know. But when it comes to the concept of trauma, it's one of two things. It's either one does the traumatic events one has experienced, pass it on to the next generation. That's where the concept of intergenerational trauma may come into the fore. Or maybe overcompensate because you don't want to identify with the parents who was actually abusive. So you go above and beyond to meet your child with every form of such abuse.
Yeah.
Yeah, so that would be the two, either two extremes. But there's a third option because it's not always binary. There's a middle ground in between where good enough is what we're all aiming for. And the concept of good enough as a parent is for you to be sure that you're doing right and you are tuning yourself with your child. Your faith may play a part. What are your values? What are your belief systems? If you're a religious person, what does your religion say about certain things? That may be the guiding compass. But I don't think anybody has it all figured out when it comes to parenting. You know, um, yeah, that's what I would say in that regard.
Yeah. Yeah. Thank you so much for that. Now, let's talk about healing and people going for therapy because I don't know why is it that Africans or Nigerians we don't talk about therapy a lot. The other day I sat down with
Yeah.
a senior colleague of mine. She when I got registered as a pharmacist, she had been a pharmacist for like 20 years. So things happened, situation happened to her, life happened to her, and we're sharing. And I asked her a question. I said, "Ma, have you gone for therapy for this?" She said, "Who goes for therapy? Who goes for therapy? Have you seen any African going for therapy? What do you think about that?"
I think maybe is a maybe it's a generational thing. There was a time when people don't talk about their emotions. It's just you're not physically sick with a fever where someone can touch your body and you're hot. Your body is hot. Nobody knows really what's going on. You just get on with it.
Yeah.
I also think for a developing country, therapy it's a luxury. People are still trying to get their basic needs met. How do you get money for therapy in the first place? So the substitutes for therapy will be of faith-based groups or your family. That will be the substitutes for therapy. They are not structured forms of therapy, but it gives you solace and a transient comfort of some sort. At least you may not have resolved it, but it instills hope. When there's hope,
Yeah.
honestly, I think that is awesome. When hope is taken away,
Yeah.
in fact, the therapist will want you to be well to some point for you to be able to think in certain capacity with them to problem solve. So my
Yeah.
little understanding of why maybe therapy may not be considered by many people from Nigeria, where I'm from, is because there's a financial implication. Other people are taking on the role of it, informal therapists, and we have the crack on with it mentality. Stop sulking, just get on with it. Yeah, which may be a double-edged sword. But people are now more exposed. Therapy is easily more available. We have the likes of is it Better Help or something online now. So you don't need to physically travel to some offices somewhere. You could have it done online. So there's ease of access. So yeah, I think that has made it.
So do you think if we had these facilities in Nigeria, for instance, at a maybe more subsidized rate, people would actually
They may or
trust
may
them.
not. Trust is a big thing. If you're telling people your deepest thoughts, I need to be sure you keep it in great confidence. So
Yeah.
I think with time, people will definitely take it on board. I'm of the school of thought that the concept of boundaries around geographical spaces is gradually being broken down with social media. Now, if you're in a different continent, we're 11 hours apart and we're having this conversation. So how that may translate to the average man on the street is we're learning of each other. There's the concept of culture is not so circumscribed anymore. There's so much infusion from other people you're learning of. So that means we're more open and receptive to certain things that we will not have been receptive to maybe years before. So I think they may take it on if they realize maybe role models, actors and actresses. If I hear the likes of Funke Akindele is maybe therapy, I'm more likely to say, oh yeah, why not?
Oh,
That was just a joke, but yeah, I think people are more receptive because information is everywhere now.
yeah. So for someone listening right now or watching the show, and the person recognizes that, oh, my current anxiety or my relationship patterns or problems stem from my childhood, what should be the first step toward
I think
healing?
they started the process of healing already. Self awareness cannot be overemphasized. Man, know thyself. If you know what the problem is, that's the first step to healing. Next thing will be seek professional help. It protects you because hopefully it's going to be a confidential space. He's a trained person who has the wherewithal to support you. Yeah, and it stays within that space. So seek professional help as soon as you know what's going on.
Okay, okay. Can you like just briefly in 1 minute tell us what does the psychiatric support look
Okay.
like for them?
So it depends on what the manifestation of trauma is for that person. If they're having acute stress response, for example, they may need treatment. So we use the biopsychosocial model when it comes to treatment. Biological will mean medication, you
Yeah.
need to take your tablet, I mean, you need to prescribe anti-anxiety medication if I think this person is presenting the symptoms of anxiety or maybe depression. I'll give them medications for that. Then, as if the symptoms have resolved to a great degree where they can sit and tolerate the process of thinking about what may have happened to them
Yeah.
and working alongside a therapist, then the psychological aspect of treatment comes in. That does not mean they need to wait. It can happen concurrently. It's a function of the severity and intensity of their presentation. Then the social aspect is also what is going on at home. People don't come up with mental health illness from the sky. I still go back to the home environment, the perpetrating factors for mental health condition. We want to know what's going on at home, what are the stressors are more likely to keep things going. And then we'll try to think together. The third sector services, if it were finances, for example, and they're in debt, we want to think about charities that may be able to help them, or even if it's payment plans, discussing with the bank and all. Yeah, all of that does not need to happen with the psychiatrist. Sometimes we have other allied professionals who work alongside within the team that can support the patient.
Yeah. Okay. All right. Dr. Kemi, thank you so much. Thank you for all this wisdom, this knowledge,
Thank you
everything
for
that you've
having me.
shared with us today. However, if you're to leave our audience with a piece of advice regarding how to reclaim our lives from past trauma, what would it be?
That's a big one. Well, I think the first thing would be know yourself. If you know yourself,
Yeah.
that'll be the first step in my opinion to healing. Because self awareness gives you great insight into what the challenges are. If you have trusted confidence, they'll actually pick their brains about what's going on. They don't necessarily need to be family members.
Yeah.
And then from there, you come up with ideas of how best to proceed with things. Essentially, look after yourself. The concept of trauma, yes, is huge. It's never the same for everyone. Also, people also experience post-traumatic growth. Things happen and you learn off, and in fact, you become well off for it. There are many testimonies of that happening. So yeah.
This post-traumatic growth, I think this is my first time of hearing that concept. Do you think it relates to high achievement or overachievement, like people who are achieving so many things, as one thing is ending, as one breakthrough is coming forth, they are thinking about the next step? Do you think that is what
No, not
it's
quite. So it's usually within the context of what the traumatic event has been. So, say for example, this is just an example,
yeah,
someone who may have been a victim of rape have been able to recover. Recovery means maybe being able to sustain intimacy. They don't have any active stress response as a result of the sexual trauma, and in fact have been able to pick up what they've learned from their recovery journey and translate it into learning for other people
yeah,
who may have experienced similar things.
yeah,
So not only have they recovered, they translated the learning they picked up to help other people as well. So what was meant to damage them has actually turned out well, so to say.
yeah.
That would be my simplistic way of explaining that. Overachievers, on the other hand, could be for different reasons. That would be a separate podcast. Yeah.
Yeah. Wow. Okay. Thank you so much for the clinical wisdom, your empathy. In fact, even with all the technological hitches we had today, you've been so patient, and yet the practical clarity and everything that you brought to this episode
Thank you, bye.
today, we're grateful. So, to everyone listening, or before I round up, Dr. Kemi, would you still have anything
Well,
to add?
I think we've
Anything
covered
to say?
quite a few. What I will say as a finishing note is
Yeah.
don't keep quiet. There's so much out there. There are resources out there that can help you. If you feel you're struggling with your mental health, please seek help from trusted professionals. But it's also a function of which part of the world you're in. In Nigeria, there are things out there as well. There are a couple of websites. So that's how things have progressed over the years. Please Google it. Speak to trusted people. That's the first step to get yourself back to where you should be.
And of course, if you feel we've not covered maybe your own case, or we've not covered deeply an hour or an episode, the 57 minutes episode is not enough to actually cover childhood trauma and its effects in adulthood. So this is like a high level summary of what's currently exists and what obtains in people's lives. So yeah, thank you so much. And to everyone listening or watching, remember that acknowledging the past is not about staying stuck there. It's not like Stockholm syndrome. Yeah, Dr. Kemi, you didn't mention that. But it's about giving yourself the tools to build a healthier, more intentional future. Thank you for tuning in to Roda 360. And if this episode resonated with you, please share it with someone, like, engage with the episode so that it can, the algorithm can push it to other people who might be interested and who might need to hear it. So thank you for listening, and
Thank
see
you.
you in the next
Bye.
episode. Bye.